Hi, my name is Marcus. I'm now going to take you through a static postural assessment. The purpose of a static postural assessment is that it enables us to identify any postural deviations we may have with the client. It also enables us to identify the origin of the deviation and also the degree of deviation. If we do identify any postural deviations with our client, we can then determine whether there will be a contraindicator to exercise. Remembering that a contraindication is anything that is present is potential harmful to exercise. We can also determine the effects of the postural deviations on the proposed exercise program, and then we can work out if there is an increased risk of the exercise we are wanting to prescribe. If we do identify any postural deviations, as a personal trainer, it is outside our scope of practice to undertake any form of rehabilitation or training program. Therefore, if we do identify any postural deviations, all we do is simply fill out the form, circle on the diagram where these deviations occur, and then we write a referral and send our client off to appropriate allied health professional. Today I'll be taking you through a static postural assessment using a plumb line made of string with some weights on the bottom to help keep the line steady. Today we'll be looking at the client from three different angles. We'll be assessing our clients from the static posture from the anterior perspective, the posterior perspective, and the lateral perspective. By doing this, it enables us to make sure that any postural deviations are identified. Okay, Ray, now I'm going to go through is the static postural assessment on you now. And the view I'll be looking at first is the anterior view. I'll be looking at a number of landmarks on your body, and I'll try and line the plumb line up with that line of best fit. So I'll probably get you to move around a little bit until I get you into the perfect position. And so if I get you to stand up straight, your hands by your side, feet in, yep. And I'll just get you to move slightly to the left a little bit. That's, hold it there, just slightly back a bit, hold it there. Okay, now I'll just get you to start stepping up and down, and I just want you to have a think about things that are going on, maybe for the weekend or things that are coming up, and try and take your mind off your actual posture yourself, so get that relaxed thing. So yep, just stop it there. And what I'm going to do is just mark on this diagram that I've got here any deviations or my results. So if you stand there, and straight away I can see that your left shoulder is slightly elevated, so I'll just note that down, and also that your head is tilted to the left, slightly to the left, so I'll just note that down as well. The reason why your shoulder could be elevated could be the upper trapezius could be overactive, and the levator scapula could also be overactive as well. And that also could contribute to why your head is slightly tilting to that, favouring that side. It's because it's the shorter muscles on the left hand side of that. So to fix that, what we're going to do is look at stretching your upper traps or your levator scapula as well. And the muscles that we're going to try and strengthen are your lower trapezius. So I'll just show you, step back. So you've got your upper trapezius up the top, the traps up the top, and your lower ones down the bottom. And the exercise we'll look at introducing into that is the seated row, and that'll help with correcting those deviations. Okay, now what I'll get you to do is turn to your left and face the, yep, well, doesn't matter whichever way, yep. And then what I'll do is I'll just line you up, so if you step backwards slightly, a little bit more, forward a little bit, slightly back a little bit, just hold it there. Alright, I'm just going to mark on the form if there's any deviations, and actually it looks pretty good, actually looks really good. So if I get you to turn around and do the opposite, the other way, yeah. I'll just get you to move slightly forward, just slightly back, just a little half again forward, top there, yep, and I'll just have a look, mark it down, and that looks pretty good as well. So I'm actually happy with your posture in your lateral position. Okay, so what I'll get you to do now is turn around, and so your back is facing me. And I'm just going to get you to move slightly to your left. Yep, a bit too far to the right, a little bit to the left. Hold it there. That's good. And so this is the postural assessment I'm lining you up with, and straight away I can see that there's that deviation on that left hand side. So it confirms the anterior assessment that I did previously, that first assessment. Okay, if you're going to turn around, and what I'll do is I'll just give you some feedback. So I don't have to refer you to like to see a physio or any allied professional help. I think, but certainly if you do start to get some pain in your shoulders or your neck or your ankles or your knees, then we'll certainly refer you to a physio, and they'll be able to look at you a little bit more and move forward with that. From the results, we pretty much confirm that we'll be looking at stretching your upper trapezes and strengthening your lower trapezes as well by doing that seated row. So does all that make sense? All the different tests that we went through?
Yes, thanks.
Yep.